Growing Up in Australia is a nationally representative longitudinal study of child development. Every 2 years, we have collected information on the children to learn about aspects of their lives at different ages and stages. This information helps researchers and policymakers better understand child development within Australia's social, economic and cultural environment. Here's a sneak peek at this year's report. Starting at home. Most children are growing up in a house owned by their parents. Apartment and townhouses are increasing in urban areas, and the percentage of families who rent their homes has increased. For most families, the costs associated with housing are their largest expense. Families with below average income who pay 30% or more on housing costs are experiencing housing affordability stress. Families who rent are more likely to be experiencing housing affordability stress than those paying off mortgages. Early education contributes to children's physical, social, emotional, cognitive and communication development, supporting their readiness for school. At ages 3 or 4, children who attended 2 years of preschool found it easier to transition to school than those who hadn't attended kindergarten or long day care. As children become adolescents, their friends become an important source of support and advice. By ages 14-15, nearly 3/4 of adolescents had sought help from a friend. Friendships that are positive, respectful and encouraging are protective for young people through the ups and downs of teenage years. Many young people reported having good friends they could rely on. However, family remained the preferred source of support and advice for personal and emotional problems over formal services, including online. Also, every second teenager with mental health issues reported they were aware of and likely to seek help from health professionals. Kids and food. It can be complicated. Negative attitudes and problematic eating behaviour can represent a risk for the later development of eating disorders, poor mental health, social engagement and school performance. The picture that is emerging is that 14-15-year-olds' desire to control their weight can be traced back to ages 10 and 11. Their attitudes towards healthy eating, activity and body weight are being misinformed by a range of media promoting unhelpful stereotypes. Every child deserves a happy, healthy start to life. The data collected for Growing Up in Australia informs policymakers and researchers about children's development in Australia's current economic, social and cultural environment.